Symptomatic therapy. So what are the typical modalities that we use to treat the common cold? I tell my patients to start off simple. I really don't recommend initially starting off with combination therapy, meaning the medications that are over the counter with multiple agents, expectorants, antitussives, decongestants. You really don't want to start with a combination therapy where you're just treating multiple symptoms. You want to identify your symptoms early, figure out exactly what you want to treat, and then pick the appropriate agent, over-the-counter agent that you need. And you may need to discuss this with your primary care physician before making this selection. I do usually tell my patients to start off with something like a mucolytic. Guaifenesin is a mucolytic, also goes by the name of Mucinex. And so what does it do? Well, it thins out your mucus. It basically is in the category of agents called expectorants. It will thin out your mucus. It'll help you clear up the phlegm that's built up when you start developing the common cold. So usually the dosage is about 600 milligrams of guaifenesin twice daily. You will take it usually 7 to 10 days as long as your symptoms are present. If your symptoms are going longer and you need this medication for a longer period of time, talk to your primary care physician. You can also use the extra strength dose if you're having more severe symptoms, and that's 1,200 milligrams twice daily. Decongestants. So the next category is basically decongestants, medicines that you will use to help relieve nasal congestion, and a common medication that is out and available for you over the counter is pseudoephedrine. When you look at medicines like guaifenesin and Mucinex, you will see that at the end it'll say Mucinex D or guaifenesin D. The D stands for pseudoephedrine. And so these agents will help with that nasal congestion. Just to give you a little background on pseudoephedrine, that D that's with the Mucinex, these agents are placed behind the pharmacist counter, and the reason is pseudoephedrine has been used illegally to make amphetamines. So there is a little bit more control on these agents. They are effective, but it is something you have to use with caution. And the reason is pseudoephedrine is associated with cardiac arrhythmias. So if you have a history of cardiac arrhythmia, or rapid heart rate, problems with your heart, you want to speak with your primary care physician before starting this type of medication. Phenylephrine is another decongestant that is available to you, and it goes by the name of Sudafed. So either the pseudoephedrine or the phenylephrine are appropriate decongestants. The pseudoephedrine tends to work a little bit better or is slightly more effective than the phenylephrine, but you can give them both a try as long as you don't have any type of contraindication to this. Antitussives. So let's talk about cough suppressants. Dextromethorphan is available to you over the counter. So when you go out and purchase Mucinex DM or you see guaifenesin DM, the DM stands for dextromethorphan, and it basically helps with postnasal drip and cough and the nasal obstructive process that takes place when a cold has been ongoing for a few days. We tend to not use the DM or the dextromethorphan early in cold symptoms. They tend to really be most beneficial when you use it later on when you're having a cough and it's been going on for 2 or 3 or 4 days and you're starting to have that post-nasal drip, that nasal obstruction that's causing you to have that staccato type of cough. So these are fairly effective. The other agent that is commonly prescribed is codeine or a derivative of codeine. So you may have your primary care physician write for Robitussin AC or Tussin Penkinetic, which is basically a cough suppressant. They're codeine based, and they tend to work fairly well. Caution if you have an allergy to codeine medicine, as well as if you are considering taking dextromethorphan. If you are also taking if you are taking antidepressants such as Lexapro or citalopram, which are SSRIs, talk to your primary care physician before starting dextromethorphan because you can develop what's called serotonin syndrome, which is a complication where your serotonin levels rise high, and that can cause some medical problems. So you do want to talk to your primary care physician before taking dextromethorphan, particularly for a long period of time.